Welcome everyone who's on the live. We're officially in National Infertility Awareness Week, and I am Sydney Bookall. I'm from Resolve. I'm the Senior Manager of Communications and Programs, and we've been, I was just talking with Shannon about all the amazing things that we've been seeing happening so far during National Infertility Awareness Week. And I'm looking forward to this conversation because I work very closely with Resolve's volunteer-led support programs. So definitely willing to jump in whenever I can to this conversation. But just to give you a little overview for those who aren't too familiar with Resolve, we are the leading patient advocacy organization, and our mission is to improve the lives of all people who are struggling with infertility or trying to build a family. We do this in a number of ways through our programs, initiatives, and events, and you can learn more about how to be involved at our website, resolve.org, but specifically if you are interested in our volunteer-led peer-led support group program, you can go to resolve.org/first response to learn more about how you can join a support group, or you can start your very own support group in your state. So with that, I will let Shannon take over and start as the moderator, and then you'll introduce yourself, and Dr. Grill, who's our special guest, but also Resolve's board chair, can also introduce herself as well. So thank you both.
Perfect. Thank you so much. Yeah, by way of introduction, my name is Shannon Willardson. I am a full-time content creator. I'm a mom of 3, and I am just honored to partner with First Response and Resolve on this conversation. I've had my own version of an infertility journey myself, and just can't stress enough the importance of connecting with others in the community to find support, to find your voice, and to just know that you're not alone in those struggles. So I feel, again, just very appreciative to be here. And Dr. Grill, very excited to talk to you. Would love to hear more about what you do.
Absolutely. So glad to be here, Shannon, with you and Cindy with Resolve. It's always a pleasure, and I'm so thrilled to be representing all of us on National Infertility Awareness Week. Of course, anytime I'm asked to speak about the emotional aspects, I'm always thrilled, but especially on a week like this week where it's so important that our voices are heard, and it's so important that we validate the needs of people who are struggling, because it's just a topic that isn't discussed nearly enough. I am, I guess by way of introduction, I am the Director of Psychological Services at the Center for Reproductive Medicine at Weill Cornell Medicine in Manhattan. And I've been doing this work for over 20 years. It's really a privilege and honor to be working with individuals and couples over the years in the format of group therapy and individual and couples and marital therapy, to really address the emotional aspects. And so to jump right in, I think I'll throw a few statistics out at you, and then Shannon, I'm gonna turf it back over to you and your more personal experiences. But just to set the context, we now know that the World Health Organization, we used to always quote, 1 in 8 people are struggling. And now they just came out pretty recently saying that 1 in 6, I believe it is, globally people are suffering with infertility. So what this means is that it's really common, right? It's not talked about, there's still stigma, but it's really, really common. And we know that the distress levels are so high in terms of depression and anxiety. There's so much research out there. There's groundbreaking research by Dr. Ali Domar that was done a long time ago that compares the distress levels of people going through the infertility experience with those who are diagnosed with cancer or other terminal illnesses. We know that on a life event scale, it's up there with divorce and death of a loved one. We know from Dr. Kash's work at UCSF that the rates of anxiety and depression are as high as like 75% or higher. So I stress this for 2 reasons. Number one, it's to validate how normal it is to feel super anxious and distressed while you're going through this. And to also make it known that this isn't just like, oh, it's a bad day, I have the blues. These are clinical levels of depression and anxiety. So for people who may never have experienced this level of distress before, it's a tremendous burden to have these feelings. So Shannon, I wonder, you've been very open about your personal experiences. I'm wondering if this resonates with you at all.
Oh, 100%, 100%. I'm one of those, to your point about, sometimes it's a new experience. Like I had never experienced depression or anxiety. but definitely felt all of those things as I was going through this experience with my family. Just to give a little bit more context, our journey with infertility is somewhat unique. We have 3 children naturally, but 2 of our children, my daughters, have an extremely rare genetic disease. We didn't find out until my first daughter was a year old. My husband and I are carriers of just this really rare genetic mutation. We had no idea. And so we pursued IVF as a way to, avoid perpetuating that disease further. And that was kind of when we were met with our struggles. I naively my husband and I both did, naively went into IVF, almost kind of assuming it was going to be a slam dunk in some ways, for lack of better terms, just because we had success in the past. And then when that absolutely wasn't the case, it was just such a slap in the face. We had, I had low egg count, poor egg quality, just really, really discouraging things I was hearing from my doctor and the folks that were helping us on that journey initially. Our first 2 cycles failed, go through all of that, and nothing comes out the other end, so to speak. And to just be really transparent, it was a point of feeling, I would describe it as despair. Truly just a feeling of like hopelessness and just kind of this like really this darkness, that like that you kind of in that moment have a hard time seeing how you're going to make your way out of that. And so I love hearing the statistics that you shared, that there's so many of us, that are in this boat. Not that any of us wish that on each other, but it's like, there is something comforting about knowing that like, it's actually common. And there are so many people that are going to be able to relate to those struggles and help you through those really intense emotions that are so real. I think it's really empowering to know that. I wish I had known that at the time. And yeah, but to your point, it was very, very challenging, very, very challenging.
And it's so brave of you to come forth and to make yourself vulnerable enough to speak on behalf of so many, because this whole theme of the week is about finding your voice and power in numbers and speaking out. And there's so much isolation and shame that are involved in this process. I think, I had mentioned that the distress levels are equal to those experiencing cancer, but the main difference is that when someone's diagnosed with cancer, everyone rallies around them. Community comes together. It's like, who's going to go to Julie's chemotherapy appointment Thursday and who's delivering food the night before? And when someone, confides in someone else and says, hey, I'm struggling a little bit with this family building journey thing, and I thought the first IVF cycle was going to be a slam dunk, and like it didn't work, and I'm feeling this despair. You don't have these communities of people where you have like, Resolve and First Response, of course, but you don't have like these friend groups coming together saying, who's going to give her the injections Wednesday night? Who's bringing dinner over the night before retrieval? Who's going to sit with her in the waiting room? And so that shame and isolation, right? Did you experience that kind of withdrawal from people and the isolation?
Yeah. Yes. And I think part of that too is that like something about infertility just doesn't feel quite as cut and dry, because we all hear those stories of people who, we tried for a year and we were just at our wit's end and then suddenly got pregnant, or, it's like there's all of these moments where you feel like, I don't know, it's almost like you don't want to think that you are in that boat. And so I think that can be hard too, it's not like a diagnosis suddenly and where it's cut and dry like that. And so to your point, yeah, it can be very, very isolating. And there's the aspect of how much of this do I feel comfortable sharing? What am I going to be met with? In our case, at times, because obviously we have been really open about it, but there was some times where it was met with judgment. Like in our case, we have 3 kids, right? So, kind of this feeling of like, well, what's the big deal? You already have kids. Why are you even sad about this? Or like, why are you even doing this? Why are you doing this? Why are you going to all this trouble and putting yourself, like, this is all self-induced, and, you know, and a lot of criticism, which again, it just adds to those feelings of isolation, depression, anxiety, especially when it's not going well. And then it's even more so like, maybe, you know, I mean, I even had people say things like, maybe the universe is trying to tell you things, or, you know, people just inserting their opinions where it's not being asked for, or even well-meaning folks who just, you know, in their defense, like, it's just hard to know how to comfort someone who's going through that, especially if you've never gone through it yourself. And I think that can be part of the isolation too, for sure.
Yeah, I refer to that as the stupid things that people say. So, you know, it's like, yes, you can give them the benefit of the doubt. I'm always the one that says, look, it's usually well-intended. Usually there's a few stragglers out there that are just being mean. But, you know, what do people do with that? And I think that having coping strategies and tips are really important. So as a psychologist, I always say, like, build your toolkit, because the coping that you're used to using may not work right now. And the sense of loss of control that people feel, there's so many losses, and I'm sure you can relate, right? There's loss of self-esteem and identity and even sexuality and intimacy and friendships. There's just loss upon loss. And then loss of a cycle not working, you know, loss of a miscarriage, all of these things. Loss of you know, having children with genetically related abnormalities and issues and special needs. There's just so much loss. But the loss of control that people feel is so profound, because you can't control how many eggs you're going to get. You can't control the outcome. But what you can control are behavioral things, right? You can, like you were saying, how do you deal with these insensitive people? Like, I try and share things, and then they're super judgmental and rude. So having boundaries in place is really important. That's one of the tips I give people, is rehearsing narratives for when people say really stupid things, right? Coaching people around you about what you need. Like, hey, this is kind of not a nice thing to say. Here's what I need. Here's what I don't need. Back off, come forward, you know, and being able to communicate those things are really important. So there's a lot of tips on Resolve's website for that. There's an app I created with Dr. Ali Domar called Ferticom. You can download that. It has actual scripts that you can use. Some other tips are like, permission to self-protect. You know, some people feel like it's really selfish, and we confuse selfishness with self-preservation, right? Mm-hmm. Or self-nurture. So I really want people to tease those apart. You know, we throw around the word narcissism so much in our society. Like, you're not selfish and you're not a narcissist if you need to pull away from people temporarily, or if you need to protect yourself and set boundaries with people. And so, you know, I don't know if that resonates with you, but like having scripts ready to go for people that catch you off guard.
I love that. Yeah, absolutely. And it makes me think of a question for you, Dr. Grill. You know, in terms of, you mentioned control, and that was something that was really, really challenging through our journey. Again, for more context, we ended up having to do 6 cycles of IVF, and we just did our first transfer on Sunday. So now it's that boat of, again, so much of what makes the infertility process, I think, challenging, at least in my experience, was that there's all of these different kind of check-in points that have the propensity for dashing your hope, so to speak, or throwing you into one of those fits of despair. And you know, I'm in one right now. It's like I will be finding out whether or not it worked, and I already know that if it didn't, obviously I'm gonna be sad, right? Like, those are real emotions. But you mentioned the control. Where does mindfulness play into having some control, in the sense of, like, you know, you're going to feel what you're going to feel. You can't control the outcome, but to your point, maybe there are some things we can control in terms of how we choose to look at those results, or how we choose to nurture ourselves through that. What role does mindfulness play in all of that, in your opinion?
Yeah, mindfulness is great. There's a lot of research behind mindfulness. I would broaden that out to just say any cognitive behavioral mindfulness relaxation technique that you can get your hands on is really important. So you know, self-care critical. If everyone after they get off of this live can make a list of 20 things that bring them pleasure and joy, and then and you can do it with a friend or a partner or family member, you know, just make a list of them and then decide how many of those things you're incorporating into your daily life. And if you're not incorporating at least 3 or 4 of them, bring them in, right? It can be lighting a scented candle, making a cup of tea. It doesn't have to be trips to the Bahamas. You know, it can be like just engaging in the senses, because it's so critical, especially in the 2-week wait after transfer, where you feel so out of control and you're not getting confirmation every day about what your follicle size is. You know,
Right.
you need distraction and you need joy and pleasure. So that's one thing that you can do, one really concrete thing you can do. And then I'd say managing negative thoughts is a really important one. And we know the 2-week wait is the most stressful time, but of course the whole process is just stressful. So I feel you that you're right in the thick of it right now. But the negative thoughts are really hard for people. That what if this doesn't work and I'm never going to get pregnant? And what if I can't complete my family the way I want? And what if, you know, and all the what ifs, and, you know, the catastrophizing. So if we can slow that process down and think in a more balanced way, I mean, you don't have to, you know, flip it to positive thoughts. You just want to say, yes, I'm scared that this may not work, but I've done absolutely everything in my power, seeking out the best treatment, the best doctors, and I'm confident that the doctors, you know, feel good about this. So anything you can do to balance it, because people who are struggling with this tend to have that anxious, depressed lens, and all the thoughts kind of go down the rabbit hole and begin to like be all or nothing thinking, and we want to stay away from that. So distraction, you know, again, the mindfulness breathing, just count from 10 down to 0. Take a deep breath in and a deep breath out with each number until you get to 0 and check in with yourself, you know? So very simple, easy things that you can start doing right now that will help you feel in control.
I love that. Oh, that is such good advice. I needed to hear that. Distraction. I'm like,
Yeah, distraction.
Yeah, absolutely. Well, and I know for me, I mean, you mentioned just some tips that in my mind, they're almost like more pragmatic tips. That has been a huge help to me. I remember one of the most impactful pieces of advice that my doctor gave me. We ended up switching doctors halfway through our process, and just a little shout out for making sure you choose a doctor that you connect with. The difference between their 2 vantage points was like night and day, and just having someone who's in this fight with you, so to speak, that you feel like is also a positive person, has a positive perspective, was it was life-changing, honestly. But one of the things that she said to me was, you know, we just have to, like, having another baby is possible. We just have to do the work. And, you know, the fertility treatments are the work, and we just have to lean in and do the work. And something about like kind of making it more pragmatic like that, and it disarmed it a little bit for me. And it made me feel slightly less emotionally attached to every little outcome, which for me ended up being really, really helpful. Because again, her follow-up to that was, no matter what happens, you will always have options. We will always just keep moving to the next thing and trying something new, or just, you know, exploring other options. Like, it was always just this feeling of no matter what it is, it's going to be okay, and we're going to move forward. And that was so, so helpful to me. I'll also say, you know, to your point about community, and I think that's the whole focus of all of this, it was so helpful for me to connect with other women who were going through the same thing, because whether they had been through it previously or they were in it, you know, in the thick of it with me, it's like I would hear some story that would kind of reinfuse that hope of like, oh, okay, like it wasn't just a easy breezy for them, but look at their outcome. Or even just seeing someone who, I mean, this sounds odd, but like maybe someone who at one point was in what I would have thought was my worst case scenario, and they're okay. They're still thriving, and they were able to get through that. And just knowing like, okay, even my worst case scenario it's going to be okay, you know? And I think the connection with other people who can relate to what you're going through, it helped me to see that. It helped me tremendously to be able to see that perspective.
Yeah, you're raising so many important points. I mean, the sense of community, but also assembling your team and your doctor team as well, right? So finding people that you know you can work with who support you and who are going to tell you the reality of a situation, but also you know, explain to you what the plan is and work with you and have the kind of bedside manner you need. And then having other people in your life, you know, you got to assemble the people that, I don't care if it's clergy, reach out for help if you need a therapist. There's plenty of us out there. Reach out to Resolve. Everyone's on their own journey. So it's really important. You kind of talked about that too, that you had kids first before you entered into this. But respect everyone's journey. Not everyone's the same, and that everyone can feel what they need to feel as they go through this. Assemble their own teams of people they need to get through this. There are people out there to help. You're not, you know, people are not alone in this as they're feeling, and there are coping skills and strategies and places that people can go to get what they need, so they don't have to struggle and suffer alone in despair.
Yes, I love that. Just hearing you say there are coping strategies, I love that, because I think that's one of the things that perpetuates that despair is feeling like you're stuck, and like there's it's like when you're in those feelings, it's really hard to imagine that you'll ever feel something else or that you'll ever be able to get through them. And just knowing that you can, you know, one of the decisions my husband and I made as we were starting to realize, oh, this be a much longer process than we thought. This might go really differently than we thought it would. We said we're allowed to have our feelings, but we're just not going to allow ourselves to stay in them. Like, we're not going to let ourselves make sadness and despair and hopelessness our new emotional home. So if we're feeling those things, it's okay, but we're going to find a way to reinstill our hope, or to kind of, you know, find a way forward. And that was really helpful too, because it made us feel like we don't need to feel shame for the things we're feeling, but we also don't need to feel like we're going to be stuck in those kind of unsavory feelings forever, because we're just going to choose not to stay stuck there.
What about helplessness? You know, helplessness and despair are terrible feelings, and feeling out of control, terrible feelings. And so when people rely on their old coping strategies, like if I, you know, study hard for the test, I'll get an A. If I prepare for the interview, I'll get the job. Those don't transfer over to this. No matter how well you take the medications and how compliant you are, it may not work the first time, right? And so having the flexibility to learn new coping strategies that are super easy, like how fun is it to make a list of 20 things that make you happy? I mean, these aren't like hard things. Learning how to take deep breaths in and out. So as I said, don't be afraid to assemble that toolkit, and you don't have to reinvent the wheel, right? You can go to Resolve. These things are listed there. There's support groups, there's tips, there's how to talk to family members, how to get family members to talk to you. You can download Ferticom on your phone. There's scripts there and coping strategies and relaxation techniques. So, you know, join a support group, reach out, check out the websites, download the apps. There's help. And there's plenty, there's like, I think over 700 mental health professionals in the reproductive space who have been trained in this area. So if you get with the right people, you know, there's definitely help out there, and you don't have to be alone.
I love that.
Dr. Grill and Shannon, sorry to interrupt, but we actually have Dr. Kashani who really wants to join this conversation and ask a few questions, if you don't mind. I'm just going to quickly add her. All right. Hopefully she's still there. She may have dropped off. She asked a little while ago, but I will just wrap up our conversation. It has come to an end. So if you do have any questions, apologize if we weren't able to get to them during this live, but you can definitely email info@resolve.org, and we will do our best to get any answers for you and resources to you. So thank you, Shannon, and thank you, Dr. Grill, for joining us. This was a great conversation. We really appreciate your openness, Shannon. I hope that it helps other people on their journey who are struggling, who tuned into this live. So thank you again, and happy National Infertility Awareness Week, y'all. Have a good rest of your day.